In your background information, you talked about the endorsements and you described that 97% of Europe doesn't fluoridate the water. Is that solely due to health concerns or because of naturally occurring levels in the water?
No. The main reasons given by European spokespersons, and you can find it on our webpage, is number one, they don't want to force this medication on people that don't want it. So it's an ethical consideration. And the second major reason given by these countries is that they do not think that all the health issues have been resolved, with which I wholeheartedly agree. And nearly every review that looks at it is asking for more research. Well, if you're asking for more research, then obviously the health questions haven't been completely resolved. But we've got risk takers who are prepared to take a risk with the whole population.
Thank you. And now, with respect to your one slide, the CDC 2010, that 41% of all American children aged 12 to 15 had dental fluorosis. How is that defined? Are we talking about the mild, the severe? Are we talking about solely due to fluoride levels in water, or is it diet, environment?
It's total exposure, and that 41% is comprised of 28.5% of the kids with very mild dental fluorosis, which impacts up to 25% of the enamel, 8.6% that have mild, and that impacts up to 50%, and 3.6% that have moderate or severe, they didn't separate, which impacts 100% of the enamel. And I should also stress that in 2005, the CDC also reported that black children and Hispanic children had higher rates of dental fluorosis, higher rates. So it's disproportionate harm here, and no one knows quite, maybe the fellow from the CDC can tell us, but no one knows quite why black children seem to be more sensitive to dental fluorosis than white kids, but it's a fact.
And thank you for the answer, and the point you make would be helpful. You know, with regard to future speakers, a lot of the information we've gotten talks about this sort of collective impact, this accumulative impact, and it'd be helpful for someone to speak to what environmental conditions or situations create consumption of fluoride other than with drinking water. So that'd be helpful for me to understand. And also because your report talks about the fact that fluoride is neurotoxic, it sounds like that's in pretty large levels that you wouldn't get just by drinking normal amounts of water. Is that correct?
No, not necessarily. When Bill Hersey did this risk assessment, the level that he found that would be safe, I mean, if you would go through the standard risk assessments, which you do, and you have to remember that in these risk assessments, you take the lowest level that causes harm, and then you apply safety factors. You can't, for example, let me explain this. In that Chinese study, the Zhang study, they had about a couple of hundred Chinese children. Well, think about it. Those Chinese children have a fairly similar genetics. In these villages, they had similar lifestyles, similar diets. Now, you take the level at which he found harm, and that was between 0.75 and 1.5, between 0.75 and 1.5. Now, do you then say, well, then it's okay for all the children in the United States to drink water between 0.75 and 1.5? No, because in the United States, with millions and millions of children, you have a huge range of differences, different ethnic groups, different diets, different lifestyles, different home conditions. They're huge. So typically what you do is to find the lowest level that causes harm and then use a safety factor of 10 to predict what will be safe for the whole population of children. And when, of course, when you do that, the level is remarkably low that you wouldn't want people to be exposed to. But this is...
I just want to, did that answer your question?
Yeah, it does. Okay. That's helpful, and that also furthers the point with other speakers. I want to understand both the cumulative impact and other factors, whether there's genetic predisposition, other environmental conditions that relate to some of these findings in these studies. A couple other questions here.
And still for Dr. Connett.
Yes, almost done here. So I think some of his answers have covered some of the other questions. Let me just make sure.
For those who think it might be an exaggeration, to be overly cautious, divide by 10, I would remind you it's very, very unusual to expose the whole population to a toxic substance via their drinking water. It's very, very unusual, and that's why you need very tough safety standards.
That's all
Any
I have
other
now.
questions?
That's all I have, thank you.
Okay.
I got a yes, no
go right ahead.
question. And I think this might be for Paul and maybe Jeremy as well, but moving beyond the topic of actively fluoridating the water, if we do nothing, as you saw, the source water comes, 80% of it is going to come with a level that's not much different than what we're doing. So I guess I'm trying to understand, would you both advocate that we actually need to remove that naturally occurring level, or is it really just the addition? I would take from your comments that you think we should remove it, and I wasn't sure.
Yeah, I think we're going to be in a position to, once we've removed fluoride and stopped this foolish practice, once we've done that, then we're going to have to assess whether in some places we need to lower the fluoride concentrations lower than we have allowed hitherto. So it isn't just a question of stopping adding fluoride, we should reassess what, and that's where the science comes in. What is the safe level that we can expose children to? And it's going to be very, very low. And it could be very expensive for some communities to remove that fluoride.
Jeremy, did you have anything to add to that?
I saw not, so I take that.
Yeah, I mean, I can just give some more details on. So, off the cuff calculation, 0.7 milligrams per liter is about 15 micromolar. That's just a concentration, right? We use it as biochemists. Most of these, you saw that figure. So most of these reactions that disrupt some enzyme or modify something happen anywhere between 1/10 that concentration up to maybe 10 times that concentration. So, the things I'm concerned about are the lowest concentration, right? As far as removing it, I bought a reverse osmosis system after I started doing research. And I get paid to do biochemistry.
It's more expensive when you buy it for $1.5 million.
Of course. So I mean, my hopes today is that I can convince you
But
to.
you'd say yes, most likely.
Yeah, my hopes today is we can convince you that this is not a good practice, and then maybe we could figure out how to retool and reduce it in those areas that it's exceptionally high.